Well, good morning, and welcome to today's Global Health Tuesday webinar discussion entitled Energy Challenges and Creative Solutions for Global Health. Thank you for joining us, and my name is Jorge Osorio, and I'm the director of the Global Health Institute. Today's session is part of our monthly Global Health Dialogue series, featuring researchers and practitioners from the University of Wisconsin-Madison and across the globe. Our monthly Global Health Tuesday webinar series highlights the complexity of global health challenges and the many kinds of expertise needed to address them. By sharing these experiences, guests provide insights into global health, encourage conversation, and help connect colleagues locally and globally. And I think we all agree about the interconnection between global health and energy. Addressing these interconnections involves implementing policies and technologies that prioritize both improved health outcomes and sustainable energy access. In today's webinar, we'll discuss how to integrate these two aspects to ensure a comprehensive approach to global health and energy challenge. Just before we get started, there's a couple of housekeeping reminders. We are recording today's session, and it will be made available as in our archive video in our website. And we're also monitoring our chat. So please, if you have any questions, please write them in the chat for the panelists. And now let's introduce today's moderator, who will be facilitating the conversation and also will introduce today's speakers. So it's my pleasure to introduce Professor Giri Venkataramanan. And I hope, Giri, I pronounced your last name okay. He's our moderator, and he's also a member of GHI's advisory committee. And he's Keith and Jane Morgan's Nosbusch engineering professor at UW-Madison's College of Engineering. Giri has studied electrical engineering at the Government College of Technology in Coimbatore, India. He received a Bachelor of Science from the University of Madras, India, a Master of Science from Caltech, and a PhD from the University of Wisconsin-Madison in 1992. He began his academic career at Montana State University in Bozeman, Montana, before joining UW-Madison in 1999. He is the director of WEMPEC, which is Wisconsin Electric Machines and Power Electronic Consortium at UW-Madison, and the Keith Jane Nosbusch Professor of Engineering at the UW-Madison's College of Engineering. Giri has been actively conducting research in the areas of power converter topologies, microgrids, wind power systems, and utility-scale power electronic systems. He is the recipient of several major awards recognizing his preeminence as an engineering educator at the department, college at the University of Wisconsin, including he received the Chancellor's Award. So thank you, Giri, for your leadership, and we look forward for today's dynamic conversation. Thank you.
Thank you very much, Jorge. First, I want to thank the Global Health Institute for inviting this panel here and bringing energy access to the forefront of this discussion. So joining me, we have three panelists, and two from the University of Wisconsin-Madison and one from the private sector in Africa. So I will introduce each of them, and then we will proceed with a short presentation, and then we'll have interactive discussions led by questions coming from you all and also discussing among the panelists. So the first among the panelists I'm introducing is Mr. Mou Riiny. He's the Chief Executive Officer at SunGate Solar in South Sudan. He's a professional solar design, installation, and maintenance company. He's committed to improving the standard of living and development of South Sudan through the delivery of sustainable energy for private, public, NGOs, and commercial customers. Riiny left South Sudan actually as a young man during the civil war there, and he was fortunate to study electrical engineering at the University of San Diego. And during his studies, he remembers seeing a world map at night from NASA, and seeing the darkness over South Sudan inspired him to want to develop solutions for energy access in South Sudan. And following a senior project during his studies, focusing on design of solar energy systems in remote areas, he moved back to South Sudan in 2012 And in 2013, with funding support from the Institute of Electrical and Electronics Engineers and Clean Energy Investors, Mou launched SunGate Solar. From these humble beginnings, Mou has grown SunGate to over having 65 staff, 200 projects, 2 megawatts of solar online in 13 states, providing clean, reliable, and affordable solar solutions to thousands across South Sudan. SunGate Solar's core business is designing and installing off-grid solar power systems, and recently opened the very first solar-powered utility scale project in South Sudan, and now he's working to scale the model to other towns. And then we have a couple of our doctoral students at UW-Madison joining the panel. The first one is Ms. Rebecca Alcock, and she's a fourth-year doctoral student at the University of Wisconsin-Madison College of Engineering. She's studying industrial and systems engineering with analytics for human development with Professor Justin Boutillier. She completed the doctoral graduate global health certificate in this spring, and also has a distributed minor in planetary health. Rebecca received both her bachelor's and master's degrees from UW-Madison, the Department of Biomedical Engineering, during which she specialized in medical device design and human-centered design. She's obtained certificates in entrepreneurship, international engineering, with a focus on Latin America. Her research mission is to combine her current training in optimization and machine learning with her background in design to address pressing climate health challenges. Rebecca's primary work is on clean electrification of rural health facilities in low and middle income settings. And she's conducting a case study in Northern Colombia for this research in partnership with the Global Research Health Institute. And in 2020 and 2021, she also served as the International COVID-19 Engagement Coordinator for UW-Madison International Projects Office, coordinating partnership between UW-Madison, United Nations Development Program, and Engineers Without Borders for community-centered pandemic response. And third, we have Ms. Maitreyee Marathe, and she's a PhD candidate at UW-Madison as well in electrical engineering with a minor in energy analysis and policy. She is advised by Professor Lena Roald and me, myself. And her research interests include developing energy access solutions in research-constrained settings, such as remote microgrids, solar home systems, home energy management systems for low-income customers. Her research is informed by community-engaged energy access projects for underserved communities, medically fragile families, people dependent on in-home medical appliances, and people experiencing homelessness. And she's part of the Wisconsin Power Systems Research Group and also the Wisconsin Electric Machines and Power Electronics Consortium. So I want to invite each of these panelists as to present after I give a very short introduction. I won't stand between them and you. And we'll have the short presentation by me, followed by each of the panelists. And as the slideshow comes up, the energy and global health are both intertwined with each other. And it is an important aspect of global health, energy access is. And I want to give a brief introduction to a big picture, and then my panelists will go into the details from each of their perspectives and experiences. Next slide, please. It looks like I'm seeing the header slide there. Seems to be a small glitch. Yeah, okay. So this is a little graph that illustrates the relationship between human development, HDI, as it is commonly called in the development communities. It includes various measures that includes infant mortality, life expectancy, various indices that measure human development. And the horizontal axis is energy per capita, and the unit is gigajoules per year per person. And the vertical axis is obviously human development index that varies between the vertical axis scale that you can see going from 0 to 1, or you can call from 0 to 100%. And what you see here is there are two distinct, I would say, aspects of this curve. One thing you can identify, if you want to have higher human development index, we need to have reasonable amount of energy available. And particularly in the very, very steep slope at the low end of the horizontal axis, we see very, very steep increase in human development index with energy availability. And then after that, it sort of saturates, adding more and more energy availability, doesn't do a lot more to improve or to increase the human development index, because as you can say, it is saturated. And so it is the region at the low end, at the left, closer to the vertical axis that we're concerned about, where amount of energy access available for people on an annual basis or a daily basis or monthly basis provides additional benefits human development index. And this is the snapshot from 2013. If you go to the website that I have shown in the graph here, you can find an animation of this going from 1960s all the way to the 2019 or so. You can see the increase in human development along with the provision of energy access for people. And one good news across the board is, regardless of all the political various things that are ongoing around the world, we would say the human development is increasing across the board across the world. And each of these dots correspond to different countries in different parts of the continent. And if we were to look at the distribution of this human development and energy use across the world, we can look at a picture that gives a map of the world in the next slide. See, next slide, please. Yeah. So here is a graph or an indication of distribution of energy use. This is from 2022 across the world, different places in the world, how much energy we're using per capita. And the unit here is in kilowatt hours as opposed to gigajoules, but they both scale with each other. And not surprisingly, you'll see regions in sub-Saharan Africa, tropical regions is where the amount of energy use per capita is low, and that is also where you expect the human development index also being low. The good news is that everywhere human development index is increasing, energy use per person is also increasing. But there's a large gap in between, let's say, European countries versus sub-Saharan countries. There's unfinished work to be done in improving the human development and providing the access to various global health variables in regions where we don't have that level of development equal to what we take granted for. Next slide, please. The main question is the transformation that has happened in the last 2 decades in access to communications with mobile phones. And this is a plot from the graph from the Economist magazine. And it indicates across different countries percentage of population that has access to energy, electricity. And also in this little circles, pie charts, it also tells you penetration of mobile phone levels in different countries. One thing you can notice is that this mobile phone access transformation has happened with the revolutionary business model that is very different than what was used to 20 years ago, let's say in the 20th century. And those times, the electricity, mobile phone access and communication access was primarily driven by agencies from the government using wired technologies, large infrastructure costs. But the introduction of wireless technologies during the post-21st century period and revolutionary access to technologies as well as capital in these countries has brought this technology to large segments of population previously unserved, and that has changed the lifestyle for people across the world. Now, the question is, can we provide energy access following the same trajectory, not following a top-down business model, following a bottoms-up business model, very similar to what we'll hear from Mou Riiny later in the presentation, and also the discussions of what Rebecca is going to talk about, and also what Maitreyee is going to talk about, is the bottom-up provision of energy access as opposed to top-down. But access to, there are two important aspects to it. One is access to technology, and the other one is access to capital. Both of them are critical in making this happen, except that government is a facilitator as opposed to the main implementer of how this happens. Next slide, please. And this entire idea of how do we provide energy bottom up comes from this concept of microgrids. That is something that we've been pioneering at UW-Madison for more than 20 years across the various areas in Europe, in Asia, in United States. And you'll see this microgrid as a very, very common topic to address various energy access issues, resiliency, clean energy integration with the grid, et cetera, et cetera. It's a very, very, I would say, versatile technology that scales across the board. But it allows us to electrify remote locations on short notice with modest amount of investments. Can use solar, wind, also biofuel generation technologies, all clean technologies. And it can be operated using technologies that include and incorporate GSM or wireless technologies and use e-commerce approaches for payments, which is rapidly growing around the world. And then we also have local operators to implement and manage the system, not very different from what SunGate is doing. And this technology is considered among the top 10 enabling technologies for sustainable global development. And I want to, give a shout out to all UW-Madison researchers that have been pioneering in this area, that started this work more than 20 years ago, and it continues to scale up across the world. If you go and Google the word microgrid today, you'll see the expanse of its applicability from Wall Street Journal all the way to remote development and remote communities. It is a technology that scales across the space of development. So I'm going to stop here and invite Rebecca to give a presentation next, and then we will move to the other panelists after that. Thank you.
Thank you very much, Giri. I'll give a second for my slides to get up here. Katie, do you want me to share my own slides? I could do that instead. Oh, here we go. That's perfect. You can stay on. that first slide. All right, so like Giri said, I'm a fourth-year PhD student here in the College of Engineering, and I'm part of the Analytics for Human Development Lab, working with Professor Justin Boudelier. In our lab, on a general level, we use predictive and prescriptive analytics, so things like machine learning and mathematical optimization, to design systems that operate more efficiently and equitably. I specifically am interested in problems at the intersection of climate and human health. And the work that you'll hear about today on health clinic electrification is kind of my main research avenue. But before we jump into that work, I'd like to just very briefly reinforce the idea that energy access is critical to global health, as Giri's just described, and it cannot be disentangled from nearly all of the other priorities to achieve equitable prosperity. You can go to the next slide. Energy poverty is broadly defined as insufficient access to modern energy sources, and it poses one of the largest threats, I believe, to achieving the United Nations Sustainable Development Goals for 2030. Inadequate energy access deprives nearly 1 billion people around the world of educational and income generating opportunities and puts their physical and mental health and safety at risk. If you think about your own typical day, it's easy to see how energy plays an important role from the moment you wake up until the moment you go to sleep, and even, of course, throughout the night while you're not even awake. And for many of us here on this call, life would be unrecognizable in the absence of reliable energy. So when you really get to thinking about these agreed upon development priorities, you realize that we can't make full progress on the social determinants of health or achieve the majority of the Sustainable Development Goals without first securing universal access to reliable energy. Next slide, please. I'm going to quickly set the scene for you on electricity access in healthcare facilities specifically. Across the world today, there are 433 million people who receive care in a clinic that does not have any access to electricity whatsoever. That's 100 million more people than live in the United States. So this is a big and widespread problem. And the effective provision of modern healthcare, from things as simple as record keeping to administering life-saving treatments, requires reliable access to electricity. Without it, facilities offer 40% fewer basic health services, and the consequences for providers and patients are disruptive at best and deadly at worst. And these demanding work conditions disincentivize providers from accepting and retaining jobs in these clinics and deter residents from seeking care. And moreover, as a result of our changing climate, health professionals, especially those in low and middle income communities, will face greater demand in the coming years and decades, and patients will present with increasingly common and complex climate change induced and exacerbated health conditions that call for advanced care. On the other hand, clean electrification increases the utilization of healthcare services like rates of vaccination or in-clinic assisted newborn deliveries and population health outcomes on the whole. And distributed clean energy solutions like microgrids, for example, like Giri was talking about, offer the timeliest and most climate resilient option for clinics not yet connected to a traditional power grid. But without accessible and relevant renewable energy design tools, which is kind of the work that I'm doing, these facilities must wait for grid connection, or they'll turn to carbon-based decentralized alternatives like diesel, leading to pollutive emissions that contribute to global warming and cause or worsen respiratory infections, asthma, and lung and heart disease. So it's a bit of a vicious cycle. And in both of those cases, either waiting for grid connection or turning to a carbon-based decentralized alternative, these clinics and their communities are left behind in the green energy transition, which will have cumulative effects on their ability to live secure and healthy lives in a 1.5 degrees plus future. You can go to the next slide. With that context in mind, I'd like to tell you a little bit about TZUMAKE, which is our research partners for this work on rural health clinic electrification. So TZUMAKE is this very small community of about 300 people in northern Colombia. It's a fairly young community. This area was resettled only about 10 years ago by people of the Wiwa indigenous group, and they've established a very strong governance structure for community development in that short time span. They sit about an hour away from the nearest city on a plateau within the mountains, and it's very much the gateway to the rest of the indigenous communities in the region. Their local health system is comprised of these three entities that I've shown here, the Mamos and Sagas, midwives, and a local health post. So Mamos and Sagas are the men and women spiritual leaders of the community, and they are most often the first stop for someone who is sick to determine if they are out of spiritual equilibrium. And if so, the Mamos and Sagas will prescribe some medicinal plants, hold a cleansing ceremony, or make an offering to Mother Nature to restore that balance. Midwives play an important role in the women's lives during and after pregnancy, and like the spiritual leaders, they prescribe medicinal plants as well as offer advice on how to bathe in the river for pain, for example, or how to massage their bellies, to move the baby, or where even to deliver the baby, among many, many other roles that they play. And what's really, really cool about these two groups in this community specifically is that they're very aware of the limitations of their approaches. So they're actually the biggest referrers to the local health post, which is run by 2 local non-governmental organizations and a local nurse. And I think that is just a really amazing example of indigenous health traditions existing harmoniously with modern Western medicine. So the Tizumake Clinic has no formal access to electricity, and that's what we've partnered to accomplish through the sizing of a novel microgrid that consists of the solar array, stationary batteries, as well as a small fleet of electric bicycles to better enable the community health work that is already going on in this community. Is already kind of a core of their health system. And so we can go to the next slide. I will leave you today. Hopefully we can still play this video in this mode, but it's my favorite video from our May visit to Tizumake. We wanted to provide a stopgap lighting solution while we worked on kind of the math side of our research and while securing funding for a pilot implementation. And in our conversations with the healthcare providers there, we learned that currently, when caring for a patient during the non-daylight hours, they use a flashlight, which occupies a hand, or they wear a headlamp, which encourages insects to swarm their faces in the patient while they're working, both things quite disruptive to providing the patient with quality care. So while we were there, we built a small solar-powered lamp, and this video was taken at 4 p.m. in the afternoon, and I hope it demonstrates just how much of a difference even small, immediate solutions, again, like Giri was saying, can make in a community like Tizumake. So Katie, if you want to click play, let's see if this will still work. We can still only see the window that's on your desktop and not the presented version. But maybe if you just hover over the video, you'll see the play button. Yeah, let's see if that works. All right, this is at 4 p.m. in the afternoon. So just a small, it's 2 light bulbs only, and what a difference that could make for those healthcare providers trying to provide the care that they want to provide and are capable of providing during those non-daylight hours. You can go to the next slide, and I'll just say my final thoughts. What's really powerful about electrifying health facilities is that the impact is multiplicative. There are, of course, direct health benefits because with electricity access, health providers can, better prevent and treat their communities for all health conditions, whether a non-communicable disease or infectious disease or whatever it may be. It's one of the few interventions where you can actually make progress on all of these things, all of these different health conditions at the same time. And there are also indirect benefits to education, as there are fewer missed school days due to illness, and to livelihoods activities because there are people are healthier and they can carry on with fewer health challenges. So with that, I want to thank all of our partners listed on this slide for helping make this work possible. And I thank you all for your time.
Thank you very much, Rebecca. And I think we'll save all the questions for after all the presentations are done. I would like to invite Mou Riiny now to make a presentation. Thank you.
And Mou, I'll just step in and I will apologize. I am having some technical difficulties on my end. So Mou, if you would still like to share your slides, that is fantastic. I can still share your slides. However, this is the only way it's working for me right now.
Yeah, no problem. Let me give that a try.
And while Mou is working on that, again, I most sincerely apologize. Thank you to all of you for your comments in the screen. Know that we've been diligently trying on our end, so I do apologize. I'm really glad that the video was able to still be viewed. Thank you so much.
Yeah, well, it's a pleasure to be here. Thank you for having me. My name is Mou Riiny, like I was introduced. So let me get right into my presentation. So you're looking at the map that Giri was referring to. This is a map from NASA, a night map from NASA, and you're looking right there in outline there is South Sudan, which is the least electrified country in the least electrified continent, where in South Sudan, you have more than 10 million people, or over 93% of the population have access to electricity. So it is by far the least electrified country in the globe. And without reliable energy access, of course, the communities in South Sudan suffer from suppressed economic development, very low quality healthcare, and a host of other negative consequences. This map had a great impact in my life, because this is when I was looking at this with my professor at the University of San Diego, and frankly speaking, I was pretty ashamed, and I was shocked. But that's also when I decided that I must do something about it, and so that is when I decided that to start SunGate Solar. Let's see. It's a little bit of a lab. Like Rebecca referred to, as well as Giri, energy access is key to dramatically improving the standard of living anywhere. It's not just the developing world, it's really anywhere, because it connects to at least 11 of the United Nations development, sustainable development goals. And so energy access is key, not just to healthcare, but to economy, to education, and many other things. At SunGate Solar, we have a lot of different solutions to addressing energy access, from small lamps that are more affordable to the bottom of the pyramid population, to more distributed standalone systems that are more applicable for the clinics, schools, institutions, and individuals that are living off the grid. But living off the grid in South Sudan is sort of a misnomer, because there is no grid at all. So everywhere is off the grid. Even when you are in a town, there is no grid. Last year, we commissioned the very first microgrid in South Sudan, which was extremely important, because microgrids have a great impact to play in energy access, in electrifying population areas, towns, market centers, but most importantly to healthcare centers, schools, offices, and businesses in town that are more clustered in one location. It's a small microgrid, 55 kilowatt, with a backup energy storage and a diesel generator as well. now connecting 164 businesses, 3 clinics. It's has dramatically improved the business and operations of the shops and the clinics that connect to it, because for the first time they have 24-hour electricity. One of the initiatives that SunGate has started is a partnership with an NGO called Village Help for South Sudan. Village Help for South Sudan is an NGO that is registered in the US as well as South Sudan. And what it does is it builds schools and clinics and then helps to operate them. And what we are doing is a partnership to essentially electrify schools and clinics in South Sudan. It's a very new initiative, and it's a very simple concept where Village Health for South Sudan, which has been looking to provide energy access to the schools and clinics that it built over the last 20 years, what it would be doing is to identify the schools and clinics, profile them, and then goes and looks for funding. Once it has funding, then it comes to SunGate, where we have a pre-designed system with that is complemented with a computer and an electric pressure cooker that is installed and maintained over time. So this is one of the initiatives that we have that identifies the need to electrify healthcare centers and schools. And yeah, that's actually the end of my presentation. As you can see, these are pictures from Wanjuk, which is the site of our pilot project. You can see 2 of these women are in clinics, top left and on the right. Those are some of the clinics that have connected to our microgrid at the pilot microgrid site. And at the bottom there is a woman using an electric pressure cooker at the same clinic. So thank you.
Thank you very much, Mou, for sharing your experience and some of the pictures that tell the story much better than words that we talk about. No empty words here. And next, I would like to invite Ms. Maitreyee Marathe to present her material.
Thank you, Professor Giri. I'll just pull up my slides. Just confirming that this is visible.
Yes.
Okay, thank you. Hi, so thanks so much for having me here. I am, as Professor Giri mentioned, I am Maitreyee. I'm a 5th-year PhD student in electrical and computer engineering, advised by Professor Giri and Professor Lina Roald here at UW-Madison. My work has broadly been under the theme of developing energy access solutions for underserved communities. And it is hard to follow up after these really great presentations. But yeah, I will try my best to maybe explain what we've been doing in 2 parts here. The first part is energy access in rural India, back home in rural India. And you can see some of the pictures from our field work on the left of the screen. And the second part would be talking about our project around energy resilience for families that receive healthcare at home here in the United States. So first, looking at energy access in rural India. So before starting grad school, I worked with two organizations for over a year, the Solar Electric Light Company in Bengaluru and the National Institute of Engineering in Mysuru. And with that team, we conducted a feasibility study across more than 10 villages in different parts of India, as marked in red here on the map. We studied villages that are either unelectrified to see if a microgrid or a solar home system would help. And we also studied some villages that have successful microgrid installations. And then we also deployed smart solar home systems. And the main energy management technology was developed by students in Professor Giri's lab at UW. So you can see a picture from the solar home system installation here on the left. And what were our key learnings through this process? So there is definitely a push towards electrification from the government through the top-down approach, as the previous panelists have mentioned, and also through energy service companies that do this bottom-up approach, where they give they either donate or they rent out solar home systems or install microgrids. But most of these systems do not have basic monitoring and control, no element of digitization, and that additional cost is justified through many studies that say that a small element of digitization and monitoring and control can reduce unreliability and failure rates. As you can see on the left here, we had assets going missing, or assets like meters that were not maintained properly, and that could be improved if there is some element of basic monitoring and control that is introduced. We also found out that families that started out with a small solar home system, so we are talking about two small lights, one in the kitchen, one in the living room, and maybe a fan and for phone charging as well. These families are very satisfied with the system. It may lead to increased income in general. Access to electricity can lead to better outcomes, and then this increased income also increases the demand for appliances. So these families now want to potentially buy a television or buy appliances that can support their livelihood, like a flour mill. But these small systems may not support this scalability. So these were two of the technical learnings that we had. But one of the other most important learnings was that communities that had successful microgrids had entities and energy service companies that had established a trust with them. So they were a part of the project and they owned that project. And that element was key to ensure that the project was successful. Now, switching gears to halfway across the globe, talking about energy resilience and home healthcare here in the United States. So looking at some numbers, the United States is experiencing more and more power outages, and the number of power outages is doubling, has doubled across 20 years, particularly power outages that have been caused by severe weather. We also know that there are over 4.5 million Medicare beneficiaries that rely on in-home medical devices or essential healthcare services. And there are many more expected to be on other private insurances. For these families, power outages can be very dangerous for their health and can also be potentially fatal. So we did this project called as the National Science Foundation's Innovation Core. And through that, we were exploring commercialization of this energy hub. So this energy hub is the size of a carry-on bag, and it has storage, and it can be powered by solar. And we were trying to, this was developed by researchers in Professor Giri's lab here at UW. And we were trying to explore if this energy hub can act as a backup energy source for families such as that of little Lily here, who is dependent on a ventilator and oxygen concentrator 24/7. So with partnership with Discovery to Product on Campus and funding through NSF, we conducted over 100 customer discovery interviews with different stakeholders. So right from families that have individuals dependent on medical devices to city and state agencies and doctors and so on. So we found out that power outages are definitely one among the many concerns that these families have. But we also found out that it's not just the energy that the energy hub brings in that is important, but it also needs to reduce the uncertainty around energy and range anxiety. So let me give you an example. One of the mothers that I spoke to said that when she experienced a power outage, which was more than an hour long, she manually suctioned her child. So her child used a suction machine and she had a backup battery for the suction machine. But the battery did not have any state of charge indication. And so she did not know when it would run out and when she would have to evacuate to the hospital. So she manually suctioned her child for over an hour. And so I guess the key takeaway for us from this was that it's not just the presence of energy, but information about energy and awareness and control that is necessary for these families to have a better experience and to mitigate their anxiety. So in conclusion, as the previous panelists have mentioned, yes, reliable energy access definitely leads to better health outcomes among many other benefits. But along with just energy access, I think a key element of reliability is also a sense of awareness and control over the energy use. And that can be through various digitization efforts that is important to improve the user experience of the end users. And finally, I think energy access is not just an electrical engineering problem. In my opinion, in order to have a successful energy access project, we need all hands on deck. There are so many socioeconomic aspects and human behavior aspects that are important to ensure that it's a holistic solution and sustainable solution. So that brings me to the end. Thank you.
Thank you very much, all of you, for sharing your personal experiences and professional experiences. And so we'll have some questions. We have about a little under 15 minutes or so. And I think one of the questions, maybe I'll start out with one that's on the chat window, is what type of batteries were used in the installation, lead acid or lithium ion? And could you discuss the reason for selection choice? And I believe this was typed in when we had the Rebecca presenting. So maybe you can talk about it from the perspective in Colombia. And then perhaps we can, after your response, we can also move to Mou so that he can give his perspectives on energy storage, the role of energy storage in the big picture, supply chain issues, what type of technologies make sense from the experiences they've had in the last 10 years. Thank you. Rebecca.
Yeah, thank you for the question. So for our small lamp, just that initial implementation, we use lithium ion in that case. And the way we're going about this whole pilot implementation with the clinic, which we're in the process of, we haven't done the full implementation yet, but our sizing model, so our mathematical optimization model, can handle either of these as input parameters. So we can do the sizing in either case. What I think will happen is that we'll go forward with lithium ion in the case of this clinic. It's readily available nearby in that city. That's 1 hour away. We spoke with solar contractors while we were there. That's their preferred technology. Also, they're more efficient. They have a longer lifespan. They're becoming more and more cost competitive over time, and they're quite close now. And I think one of the other important things, Northern Colombia is very, very hot. In the community we're in, it reached over 100 degrees Fahrenheit every day. And I think lithium ion fares a little bit better in those cases too. So for us, it's lithium ion.
Thank you, Rebecca. Mo, can you share your perspectives on this?
Yes, absolutely. I think just as Rebecca said, lithium-ion batteries are, just more effective. For context, batteries don't like two things. They don't like heat, and they don't like to be cycled too many times. So if you cannot control the cycling, you can at the very least control the technology, because lead-acid batteries do not do well in hot environments. And for example, in South Sudan, it's extremely hot. So really, your only choice is lithium batteries. The problem is they are, while they are becoming more cost competitive, they are still more expensive. And so if you're talking about standalone system, it's still a 50-50 call, because the customer still, make the last decision based on their available budget. But when we're talking about a microgrid, that is an investment from SunGate, and definitely our bet will be on lithium batteries. It's a lot more. We can rely a lot more. With a much longer warranty. It will give us 7 to 9 years, or at the very least 7 years. Whereas lead-acid batteries can only give you 4 or 5 years. So yeah. That's a long answer to say lithium batteries.
Yeah, thank you so much, Mou. And I agree with some of these findings, because the technology advancement that's coming from the electric vehicle industry is in leaps and bounds. Certainly not in commensurate with the sort of news that you see in the popular press on how the size of the battery is going to go down by a factor of 10 in the next 5 years. That is not going to happen, but it's an incremental improvement that's 2 to 3% per year in terms of size and cost and performance is continuing to happen with all the advances in different technologies, different manufacturers across the world. I want to, there is another question about the relationship between this and the 5G networks. And I want to leapfrog. I'll probably invite the query, Sandy, to send me an email separately, because I want to move to the more interesting and important question that comes next to that is from Jorge. And it talks about how the cost of these systems, what is the estimation, what is the projection in terms of, let's say, a modest clinic, what would be the cost investment in, let's say, tens of thousands of dollars. Let's say if we want to do 100 clinics, if we want to do 10 clinics this year at a cost of 10,000, 100 clinics the next year at the cost of $500,000, what would be the, if we want to have a scale up of this approach, what would be the type of costs involved to build up technology penetration?
Well, I can answer that. There are 2 ways to look at this. One is to look at standalone systems, which have a definitive cost, because you're paying for the equipment. You're taking the equipment, assembling them, installing them, and so you have a much more clear idea of the cost. And right now, the cost range in South Sudan, which is a landlocked country, the cost range from $4,000 to $6,000 per clinic. And that is for a modest system that does not include air conditioning. If you include things like air conditioning, it can easily go over $10,000. Now, if we're talking about microgrids, then what you're buying is energy. You're just connecting them with a meter, and based on what we're seeing at at our pilot site, they are consuming about 50 kilowatt hours a month, which is actually not a lot. It's less than $50. You're talking about maybe $40 a month for a clinic, which is a huge cost saving, because previously they had to have their own generator that they had to fuel and maintain, with all the associated costs. So a microgrid brings down the cost significantly for these clinics. But then again, a lot of the clinics are outside of the towns that where microgrids are feasible. So really, we have to talk about standalone system for the clinics. It's a lot more a relevant discussion.
And I'll also just add quickly that one of the things that we try really hard to look at is this like trade-off between the size of the system, because you could really, for a standalone off-grid system, you could really oversize the stationary batteries, and that would guarantee that your system is super resilient. There will never be a time with an outage or anything like that. But there's much more cost associated with that. So what we really try to look at is, again, with our mathematical model, we look at the trade-off between resilience level and cost. So we talk with the healthcare providers in the community, and we say, what are you comfortable with? What's your risk tolerance? What is feasible for a health clinic, when the consequences could be life or death? And then we say, here are the range of feasible solutions, and here are their costs. And then the customer ultimately, like Mo was saying earlier, gets to decide what that looks like.
Thank you, Rebecca.
I wanted to.
Yeah, go on.
Sorry, I just wanted to quickly echo the same thing. I can specifically talk about the portable standalone systems that are common here in the United States, mainly for camping, but utilities in the West, particularly in California, have been distributing these systems for medically fragile families during public safety power shutoffs during the wildfire season. And they can range from anywhere from $500 to $3,000. The rate is about under $1 per watt hour. And families it really depends, as Rebecca said, on what is the risk tolerance of the family. If they want something and also the devices that they are using, if they want something that will run their ventilator, oxygen concentrator, and also a small portable fridge to ensure that their feed and medicines to store their medicines and feeds, then that might blow up to maybe a $3,000 unit. And also depends on what is their tolerance of staying in the home before evacuating to the hospital, and like that is the time when they will be using this device.
Okay, thank you, Maitreyee. We're coming to 9:58 a.m. In about 2 minutes. We want to wrap up. So I would like to thank all the speakers, panelists to share their thoughts. And all of us are available to consult with any of the speakers here through the Global Health Institute to discuss various aspects of what we presented, as well as ideas that they may have sparked in your minds. And I want to also thank the Global Health Institute for providing this forum for us to have this discussion. Energy access is an important topic in expanding global health. And our goal is to get the ideas of microgrids and standalone energy systems popularized so that people think about it and adopt them as the case opportunities happen to be. And we're happy to facilitate discussions moving forward through the Global Health Institute to develop solutions in Latin America, United States. We're not bound by any boundaries, just like the Wisconsin idea. We want to work across the world at all scales in electrification and providing clean energy. Thank you. Back to Jorge.
Well, thank you, Giri. Thanks for the speakers and the audience to join us. Wonderful webinar. Thank you to our team, Katie, Kelly, for setting this up, and wish you all happy holidays. And we'll see you in our next Tuesday webinar next year. Thank you so much, and have a wonderful day.
Thank you. Bye-bye.
Thanks, everyone.
Bye-bye.
Pleasure.
Thank you.
Bye.